Alright, what's up, guys?
I'm bored.
Nothing to do.
I've sucked.
I'm
Tired. Tyler won't give me a laser.
Why does life suck?
Tyler's here.
Tyler won't give me a laser.
It's what outside?
It's really not nice.
It's dark. I don't like it.
It's cold.
Alright, so these guys have seasonal affective disorder because it's dark outside and there's nothing to do, and all they want to do is sit around and have fun with each other. Alright, what's up, guys?
Hey guys, hey Tyler.
Car drove by. Girls.
Yeah.
Pretty girls.
Why are you guys so happy?
It's nice out.
Pretty girls.
Pretty girls. Pretty girls.
Alright, pretty girls, it's sunny. Alright, so this is Dr. Nystrom, and I'm going to ask him some questions on seasonal affective disorder. So first...
Can you more light? I'm sorry.
No, we're good.
You sure?
Yeah.
Your video?
Well...
My bad.
Alright, so how long have you been a doctor or been around patients with seasonal affective disorder?
I graduated med school in 2004, so I've been a doctor for about 8 years. I've seen seasonal affective disorder every year. I've been around my whole life, though.
Okay. And what is seasonal affective disorder?
It's a variant or a subtype of depression. It occurs in the winter months and resolves in the summer months. It also could be a variant or form of bipolar disorder.
Alright. How common is SAD?
Seasonal affective disorder, or SAD, depends on what study you read, ranges from 0.5% to about 3% of the population, all the way up to 10%, depending on various factors, your criteria for diagnosing, as well as what population. Those numbers would be indicative of people from the United States, Canada, and Britain.
Okay. And who is at risk of developing SAD?
Anyone. Anyone could get seasonal affective disorder. I would guess, but don't know for certain, people who have a history or are more prone to becoming depressed.
Alright, what are some symptoms of SAD?
Symptoms of SAD would be the same as anyone who would have symptoms of depression. Change in appetite, eating more, eating less, weight gain, problems sleeping, either less sleep but usually a lot more sleep, decreased activity, depressed mood. With SAD, though, it would be constellated with symptoms beginning in the fall, winter, and being resolved with spring and the onset of summer.
Okay. What should people do if they think they have seasonal affective disorder?
Depends on how severe their symptoms are. If they feel like they get a little down in the winter, but function really well in a very mild case, no treatment may be indicated, or you can do treatments such as light therapy or something such as that. If it becomes more of a problem with functionality or their ability to function in a daily society, or to a point where they're just not enjoying life, they should discuss it with their doctor.
Okay. What do you think is the worst part of seasonal affective disorder?
Feeling depressed.
Alright, yeah. What do you think is, or what do you believe is the best way to deal and cope with seasonal affective disorder?
That's a good question. Depends on the severity of symptoms, but do the best you can. With that, if the symptoms seem to be amenable to light therapy or something like that, then use light therapy. If something like medications, an SSRI, or medication a doctor might prescribe, then I would utilize those as well. Exercise is always beneficial.
All right, and you
just
said
keep plugging away at daily life.
You said light therapy. Like, can you explain how that works?
I don't think we actually know exactly how light therapy works. We do know that there's an association with people who use light therapy, and this would be therapy with light, with the UVA and UVB light rays. I can't claim to be a true expert in that regard, but light therapy with small doses throughout the winter months, simulating basically extra exposure to sunlight, seems to improve people's moods and their respond to the typical symptoms of seasonal affective disorder. Oh, I'm sorry.
No, go ahead.
Whether that's related to vitamin D levels versus some other mechanism, I don't know.
Are there any side effects to light therapy?
Sunburns,
Sunburn.
long-term skin cancer risk. In small doses and so forth, it seemed to be pretty benign, but with the risk of cancers with long-term exposure, there is that consideration.
All right, and if someone thinks they have seasonal affective disorder, where can they get a light box? Is that like do they have to have a prescription, or can they buy it somewhere?
I don't know of a store locally that you can get it. I know you can get them online. You could get a whole tanning bed online. As far as obtaining it with a prescription, I don't think any insurance would cover it, and therefore a prescription would benefit if you're trying to have it be covered through insurance or a third-party payer. But beyond that, it would be I think online would probably be your best bet, or I'm sure there's probably a store in Des Moines or Omaha that would have it.
All right, and so besides the light box, what are there any other treatments for SAD?
As I mentioned a little bit before, light therapy, as well as there's cognitive behavioral therapy, which is basically counseling therapy, talking things out. There's medications, several different classes, mainly would be the same medicines used to treat depressive symptoms. Exercise, what I like to call good healthy living, where you get good amounts of exercise, appropriate sleep, balanced diet, and so forth.
All right, do you have any advice for anyone that has to be around or live with someone that has seasonal affective disorder?
Acknowledge that it is a disease subtype. It is what it is, and that people actually have something. It's not just in their head. The other aspect to that is you got to be able to function and cope, and knowing that someone may be depressed, be sensitive to it.
All right, how will seasonal affective disorder affect your health?
It would depend on the severity, once again. If you have depressive symptoms, and in Iowa we have longer winter months, and you tend to see people not as active because they can't go outside, but weight gain and all the constellation of symptoms that go with that. Just a lack of enjoyment in life. If they got severely depressed and it's exacerbated or worsened by the winter months, you could see the range of suicide on up.
Okay, do you think there are any are there any positives to having seasonal affective disorder?
I don't know. I suppose you don't know how happy you can be until you're sad.
Yeah.
So to provide a contrast, but no, I wouldn't say there are too many positives to being depressed. But depressed mood is part of the normal range of emotion. Seasonal affective disorder would be a subtype of major depressive or bipolar, and so it would be going beyond that normal range of happy and sad, but for more prolonged period of time. But no, I would not wish it upon someone.
All right, well, I'd like to thank you for your time, and again, that was Dr. Nystrom.